NLN Nursing Entrance Exam Test Questions. Question 1. Which probability describes drawing a red card from a set with 2 red and 6 blue cards in this structured test item? Option A, 1/4. Option B, 1/3. Option C, 3/4. Option D, 4. The correct answer is option. Probability is favorable outcomes divided by total outcomes, so the result is 2/8, simplified to 1/4. The other choices use blue cards, compare red to blue only, or invert the fraction. Question 2. During a quick next review of a full practice item, which word is closest in meaning to crucial in a health article? Option A, optional. Option B, doubtful. Option C, essential. Option D, decorative. The correct answer is option. Crucial means essential, so that choice matches the meaning in context. Optional means not required, not essential, doubtful means uncertain, not essential, and decorative means for appearance, not essential. Question 3. After checking the choices in a nursing entrance item, which answer identifies the process moves water across a semi-permeable membrane? Option A, mitosis. Option B, a transcription. Option C, osmosis. Option D, exocytosis. The correct answer is option. Osmosis is the diffusion of water through a selectively permeable membrane. Mitosis is cell division, transcription copies DNA information into RNA, and exocytosis moves materials out of a cell. Question 4. If a pre-nursing prep STEM gives one clear clue, which inference is best supported by the passage? A patient education sheet used short sentences, headings, and pictures. Option A, clear formatting helps readers understand health information. Option B, long paragraphs are best for patient teaching. Option C, pictures make written instructions unnecessary. Option D, headings reduce the value of information. The correct answer is option. The sheet is designed to improve readability and comprehension. Long paragraphs are best for patient teaching is not supported by the passage. Pictures make written instructions unnecessary is not supported by the passage, and headings reduce the value of information is not supported by the passage. Question 5. When time is limited on a verbal practice question, which increase is shown from Monday 14 to Wednesday 22 in a simple practice chart? Option A, 8. Option B, 5. Option C, 22. Option D, 36. The correct answer is option. The increase is the final value minus the starting value, 2214 equals 8. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 6. Given the information in a math practice item, which milliliter amount equals 1.5 L? Option A, 15 ml. Option B, 1,500 ml. Option C, 15,000 ml. Option D, 150 ml. The correct answer is option. 1 liter equals 1,000 ml, so 1.5 times 1,000 equals 1,500 ml. The other choices use 10, 100, or 10,000 as the conversion factor, which shifts the decimal to the wrong place. Question 7. Suppose a similar science practice item appears on test day. Which word is closest in meaning to distinct in a health article? Option A, ordinary. Option B, humid. Option C, separate. Option D, combined. The correct answer is option. Distinct means separate, so that choice matches the meaning in context. Ordinary means common, not separate. Humid means moist, not separate. And combined means joined, not separate. Question 8. While working through a timed biology review set, which answer identifies the tiny air sacs exchange oxygen and carbon dioxide? Option A, nephrons. Option B, the villi. Option C, alveoli. Option D, bronchi. The correct answer is option. Alveoli provide thin, moist surfaces where gases diffuse between air and blood. Nephrons filter blood in kidneys, villi absorb nutrients in the intestine, and bronchi carry air toward the lungs. Question 9. Before choosing an answer in a chemistry basics item, which inference is best supported by the passage? A volunteer program grew after former patients shared personal stories at orientation. Option A, personal stories can motivate people to participate. Option B, volunteer programs grow without communication. Option C, orientation should never include stories. Option D, a former patient stopped the program. The correct answer is option. The passage shows participation increased after meaningful stories were shared. Volunteer programs grow without communication is not supported by the passage. Orientation should never include stories is not supported by the passage, and former patients stopped the program is not supported by the passage. Question 10. A student sees this critical thinking idea on a next review. Which answer identifies the group that does not receive the experimental treatment? Option A, experimental group. Option B, conclusion. Option C, sample. Option D, a control group. The correct answer is option. A control group provides a comparison for the treatment group. Experimental group receives the treatment, conclusion is the final interpretation, and sample is the participants or items studied. Question 11. One comprehension drill practice problem tests the skill, which sum equals 2/15 plus 2/5. Option A, 4/15. Option B, 8/15. Option C, 8/15. 1. Option D, 4/5. The correct answer is option. The denominators are already the same, so add the numerators, 2 plus 6 equals 8, then simplify to 8/15. The other choices subtract the numerators, multiply parts of the fractions, or change the denominator unnecessarily. Question 12. Several choices look tempting in a reading skill item. Which word is closest in meaning to evidence in a health article? Option A, delay. Option B, rumor. Option C, proof. Option D, habit. The correct answer is option. Evidence means proof, so that choice matches the meaning in context. Delay means postponement, not proof. Rumor means unverified talk, not proof. And habit means repeated behavior, not proof. Question 13. For this vocabulary skill nursing entrance question, which answer identifies the chemical messenger released by endocrine glands? Option A, platelet. Option B, antibody. Option C, hormone. Option D, enzyme. The correct answer is option. Hormones travel through the bloodstream and affect target tissues. Platelet helps clotting, antibody targets antigens, and enzyme speeds chemical reactions. Question 14. In a short grammar skill practice STEM, which inference is best supported by the passage? A school added quiet study rooms, and students reported fewer distractions. Option A, students no longer needed to study. Option B, quiet rooms increase noise. Option C, reducing distractions can improve study conditions. Option D, distractions are always helpful. The correct answer is option. The result directly connects quiet rooms to fewer distractions. Students no longer needed to study is not supported by the passage, quiet rooms increase noise is not supported by the passage, and distractions are always helpful is not supported by the passage. Question 15. Among the choices in an algebra skill item, which critical thinking response best fits this situation? A conclusion says a new study method caused higher scores, but the groups were not randomly assigned. Option A. The conclusion may be too strong because another factor could explain the scores. Option B, random assignment is never useful. Option C. The conclusion should ignore group differences. Option D, higher scores prove every student studied more. The correct answer is option. Without random assignment, group differences may affect the result. Random assignment is never useful, does not follow from the situation. The conclusion should ignore group differences, does not follow from the situation, and higher scores prove every student studied more, does not follow from the situation. Question 16. Using the facts in a data interpretation question, which dose volume gives 150 mg from a supply of 50 mg per 5 ml? Option A, 30 ml. Option B, 7.5 ml. Option C, 15 ml. Option D, 3 ml. The correct answer is option. Set up the proportion 50 mg, 5 ml equals 150 mg x ml, so x equals 150 times 5, divided by 50 equals 15 ml. The other volumes reflect errors such as doubling the dose, having the dose, or reversing the proportion. Question 17. Based on the clue in a reasoning drill item, which word is closest in meaning to indicate in a health article? Option A, a conceal. Option B, repair. Option C, borrow. Option D, show. The correct answer is option. Indicate means show, so that choice matches the meaning in context. Conceal means hide, not show. Repair means fix, not show. And borrow means take temporarily, not show. Question 18. Consider this high-yield timed practice concept. Which answer identifies the cell division that produces gametes? Option A, a translation. Option B, meiosis. Option C, diffusion. Option D, mitosis. The correct answer is option. Meiosis reduces chromosome number and produces sperm or egg cells. Translation builds proteins, diffusion moves particles down a gradient, and mitosis produces identical body cells. Question 19. Near the end of a score report review session, which inference is best supported by the passage? A report says infection rates fell after staff completed a hand hygiene refresher. Option A. The refresher removed all risk permanently. Option B. Hand hygiene cannot affect infection. Option C. A training may have improved compliance with hygiene practices. Option D. A training increased infection rates. The correct answer is option. The sequence suggests training supported better hygiene behavior. The refresher removed all risk permanently is not supported by the passage. Hand hygiene cannot affect infection is not supported by the passage, and training increased infection rates is not supported by the passage. Question 20. Across similar study plan nursing entrance questions, which increase is shown from Monday 13 to Wednesday 23 in a simple practice chart? Option A, 7. Option B, 23. Option C, 10. Option D, 36. The correct answer is option. The increase is the final value minus the starting value, 2313 equals 10. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 21. Since only one choice fits the review checklist clue, which average results from scores of 70, 74, and 78? Option A, 8. Option B, 74. Option C, 222. Option D, 72. The correct answer is option. Add the 3 scores to get 222, then divide by 3 to get 74. The other choices use the sum, the range, only 2 scores, or an added value rather than the mean. Question 22. From the information in a common mistake item, which word is closest in meaning to notable in a health article? Option A, important. Option B, hollow. Option C, a trivial. Option D, cloudy. The correct answer is option. Notable means important, so that choice matches the meaning in context. Hollow means empty inside, not importance. Trivial means minor, not important, and cloudy relates to weather, not importance. Question 23. At a testing desk during a calculator-free review, which answer identifies the solution with pH above 7? Option A, hypotonic. Option B, neutral. Option C, acidic. Option D, basic. The correct answer is option. A pH above 7 indicates a basic or alkaline solution. Hypotonic describes lower solute concentration, neutral describes pH 7, and acidic describes pH below 7. Question 24. Inside a patient chart science or skills item, which inference is best supported by the passage? A clinic sends appointment reminders, and missed visits decline. Option A, reminders caused more missed visits. Option B, patients cannot benefit from reminders. Option C, reminders can help patients remember appointments. Option D, appointments no longer need scheduling. The correct answer is option. The decline in missed visits supports the role of reminders. Reminders cause more missed visits is not supported by the passage. Patients cannot benefit from reminders is not supported by the passage, and appointments no longer need scheduling is not supported by the passage. Question 25. Through careful reading of a lab result stem, which answer identifies the transfer of heat through direct contact? Option A, radiation. Option B, conduction. Option C, evaporation. Option D, convection. The correct answer is option. Conduction transfers heat when particles collide through direct contact. Radiation transfers energy by waves, evaporation is liquid changing to gas, and convection moves heat through fluid circulation.